does medications affect the skin? That's what we're going to get into right now. Hey everybody, welcome to my channel. It's Sean from Seankbeauty. I'm super excited to bring this topic to you all because not only is this going to be helpful to Linda who requested it, so hey Linda, this video is dedicated to you, but hopefully it provides some insight and clarity to those of you who brought medication into your routine or who are taking medication, you're seeing your skin breaking out and you don't know what's causing it. So we're gonna talk about how medication affects the skin and what medications affect the skin in today's video. So the first medication I wanna pull from or pull off the shelf is accutane. Accutane just happens to be a very effective statin. When I talk about statins, I mean drugs that actually help to reduce triglyceride and cholesterol in the blood. And we know that when we eat fatty foods, the likelihood of breaking out is increased, right? So if you take a statin or something that's going to reduce your cholesterol and triglyceride levels, it's going to help to mitigate those breakouts from happening frequently. So I was put on accutane when I was in high school. I had deep scars on my skin as well as acne everywhere. My mother took me to a dermatologist who prescribed it, but shortly after my OBGYN took me off of it because what she said was, this is going to take a toll on your liver and kidneys over time. Now, one of the side effects that I did notice when it came to accutane, even though it cleared up my scarring and it cleared up the acne, is that I experienced extremely dry skin. So if you're taking accutane and you're seeing your skin is super duper dry and you also have dry mouth, that is that medication that's causing it, okay? So the way that we deal with that is just like if you're a dry skin type, you would use a, deeply moisturizing cream to get into the dermis layer of the skin to bring in that excess moisture that you need, especially when you have dry skin. So I'm gonna leave a list of those down below, affordable and on the luxury side. Now, three that come off the top of my head. One is drugstore, that is from CeraVe. That is their moisturizing cream that's in the tub. You can get that from Target. That will really help the extreme dryness. And also, if you want to go on the luxury side, the Chantecaille Gold Recovery Mask, one that I use that I swear by, even as in the winter months especially. And also, Estee Lauder has the Revitalizing Supreme. This is also a heavier consistency moisturizer, and it does a really great job, especially in the winter months. But I will leave the list of all other recommended moisturizers down below, and most of them are unscented because we definitely don't want to deal with scented moisturizers, especially when we have severely dry skin, because that'll dry us out more. And the next medication is going to be your blood thinners. Warfarin, Coumadin, baby aspirin, these are some of the blood thinners that are prescribed to really prevent blood clots. And that's the reason why we take blood thinners, is because we're trying to mitigate the blood clots and, the severity that blood clots can cause, especially death. We're trying to prevent that from happening. But here's what happens when we start taking blood thinners though. As we age, the dermis layer of the skin, this is the middle part, the middle layer that supports your blood vessels, becomes very thin and no longer is able to really support the blood vessels like it used to. This condition is called actinic purpura, where you have blood vessels that break, and what happens is blood starts to get underneath the skin, causing this bluish or purplish color. I think a lot of us have seen that, especially in the elderly. This happens mostly in those that are taking blood thinners. Now, your doctor's not gonna take you off of this medication because, again, the blood thinner is to prevent the blood clots. So, I'm not here to talk about the treatments. That is something you probably have to talk to your dermatologist about. But I want to preface something here in this video before we go even further. I talk a lot about detoxing because it is important. Whether we're using makeup, we're also using hair products, we're using, antiperspirants, we're using a lot of products daily on our skin, on our hair, even, toxins that we are subjected to, even outside. We need to do detoxing, whether it's with yogi tea or detox pills. Find yourself doing some detoxification to help the liver and the kidneys to really purify the blood, okay? And especially when we're taking medications, doing a detox is going to be key to support those organs and to also give you healthy looking skin. So let's move on to antibiotics. Okay, so let's talk about minicin or minocycline, and let's talk about doxycycline or vabromycin, okay? These are medications that we typically see in the family of tetracycline. So they're derivatives of tetracycline. I'm allergic to tetracycline. That's the one thing when I'm going to the doctors and they ask me if there's a medication or an antibiotic that I'm allergic to, that's the one I have to put down, is tetracycline. Now, minicin is one, or minocycline is one that is prescribed to those with rosacea. Those who have the ruptured blood vessels, the irritation to the skin, the redness that we see, and the issue is they deal with, how do I get rid of this? It's an irritant to me, and I won't lie, when your skin is compromised, it hits that self-esteem horribly, okay? You don't wanna go out, you don't wanna socialize, it's all of that happens when your skin is compromised. And so a lot of people with rosacea would find themselves going to a dermatologist, and this is the antibiotic that is prescribed. The downside of taking this for an extended period of time is that you'll start to see discoloration of the skin. It almost looks blue, and it happens in the areas where there is the inflamed skin. So the way that you'll get rid of these spots, because that's what they look like. They take on more of a circular shape, and they're everywhere. Everywhere that you see inflammation happening from your rosacea. You get rid of that by discontinuing the use, okay? So we don't want to use medication for longer than we need to. All right, friends, let's talk about doxycycline. Also a derivative of tetracycline. This one commonly is prescribed to those who are treating acne, has respiratory issues, urinary tract issues, Lyme disease. You would more times than not be prescribed doxycycline. The downside of doxycycline is that it makes the nail beds very sensitive. You're sensitive to the sun on the skin. It increases sunburn. If you're experiencing that, I implore you to check your dermatologist out and let them know this is what's happening, what is an alternative, or how do I mitigate this? I'm not here as your doctor to really tell you how to mitigate these issues. I'm here to tell you what medications you're possibly taking and their side effects on how they affect your skin, okay? So if you're seeing any of these side effects happening and it's giving you extreme discomfort, then I definitely implore you to go back to your dermatologist and let them know what's going on. All right, friends, forgive me if you hear the dishwasher going, but this is the best place to record. The next medication that is unsafe to use is colloidal silver, or what we call snake oil. We see a lot of people trying to treat C19, and colloidal silver is much different from the silver that doctors would use to treat wounds, okay? So colloidal silver is a liquid. It has silver floating in it. If you take this for a prolonged period of time, it'll build up in your body's tissues and it'll cause argyria, which is irreversible. Argyria causes the skin to turn blue. So we don't want to mess around with treating ourselves with unsafe supplements. Now, colloidal silver is not one, or snake oil is not one that is recommended. It is not even one that doctors will prescribe for anything. So if you're trying to take that, I definitely caution you on that one to stay clear of, really taking that. If you have an alternative, go with another alternative, or I would always default to seeking your doctor or dermatologist before doing anything like that. Remember, friends, we're ingesting this stuff, okay? So it can be poison to us, and if you really don't know, or you're really not astute to what these medications are doing and just listening to what people are saying it's going to do, you're putting yourself in danger, and that's not what we want to do. We want to seek the professionals before we start, taking matters into our own hands, okay? All right, friends, now we want to talk about heart and blood pressure medication. So when it comes to thiazides, like hydrochlorothiazide, these are some of those medications that will help you with your high blood pressure. However, what ends up happening is this does affect the skin. Squamous cancer, which is a skin type of cancer, will actually happen to you with this particular medication. I've talked about statins. Statins are ones that help to deal with cholesterol and also triglycerides in the blood. Accutane is one that I mentioned earlier in the video. You have Lipitor, you have Zocor. These are some of the medications that would actually, cause this dryness to happen on the skin. When you're seeing that happening, again, using a really great moisturizer is going to help to alleviate that. And then we have vasodilators, those that actually are blood pressure medicines. They actually open up the blood vessels to allow the blood to flow. This also can affect the skin and cause acne and rosacea. So you've got the, heart and blood pressure medications. You have antibiotics. You have even Zyrtec, antihistamines, will make you sensitive to the sun. So you want to be careful with taking, that allergy medicine and then going out in the sun. All right, friends, so hopefully this provided some context for you. If you're concerned about your skin, if you're looking at the inventory in your medicine cabinet and you're saying, oh my God, I'm taking 1 or 2 of these and this is why my skin is freaking out, this video was definitely worth being put up then. I look forward to hearing from you all. Let me know what you want to hear from me next. Leave that down below. It's very important for me to put out content that is relevant to you. Forgive the dishwasher. I love you all so much, and I'll see you in my next one. To Linda, ciao for now. Mwah.